Hello everyone, welcome to RAAONLINE. I am Dr. Abhinaya. I am a consultant pediatrician. So in the chapter discussion on infectious diseases, we are now going to discuss on cysticercosis and focused on neurocysticercosis. Okay, so let's get started. There is a brief discussion on Taenia solium. So this is the organism, this is the tapeworm in layman terms. Okay, so we are going to talk about how this tapeworm goes inside the human body. So the children or anyone, the human acquires this tapeworm infestation by two forms. One is either ingestion of the undercooked pork. Pork is the definitive host where the taenia resides. Either by the ingestion of undercooked pork or ingestion of eggs which are shed by the carriers. The humans are the carriers. So the tapeworm carriers, when they shed these tapeworms, and this infects the water, or this contaminates the water. So that is taken, that contaminated water is ingested by the humans. That is also another mode of transmission. So usually the cysts are ingested. The cyst will go inside the human body. It converts into the tapeworm. So eggs, once inside the human system, the eggs will be released. It causes the release of larvae, and this larvae will then go inside the intestines. It invades the intestines, it migrates through the bloodstream, so it goes and resides in the muscle and even other organs like the CNS. So once inside the muscle or inside the CNS, they form the cyst with the colex. Okay, so this is how the very short brief discussion about the life cycle of the Taenia solium. So the definitive host is man, intermediate host is pig, and the infective stage will be larva. So let's focus on the life cycle here. So the eggs, so this is the pig which is the intermediate host. So the eggs will be laid in the feces and that is passed on to the environment. So these eggs will be taken both by the pigs and by the humans. So that soil which is contaminated by the infected eggs, so that is taken mistakenly by the humans. This embryonated eggs, once inside the human system, will latch into larvae. This larvae will go and sit inside the muscle and other human organs. It starts developing in any organ, mostly in the muscles and in the subcutaneous tissues, in the central nervous system, in the ocular, that is in the eyes. So these eggs can be taken by the pigs as well. So these embryonated eggs are taken by the pigs as well. So the oncospheres will hatch, release the larvae. This larvae, similarly to humans, it goes and resides in the pork muscle. So the infected pork when eaten by the human, so that is also another mode of transmission in which the tapeworm will get inside the human system. So the infection with the cystic form is called as a cysticercosis, and once the infection, that is, it involves the CNS, that is called as the neurocysticercosis. So pork tapeworm infestation is widely distributed. Wherever porks are raised, it is seen mostly, like in the central and southern part of America, in southern part of Asia, Southeast Asia especially, sub-Saharan Africa. So these are the regions where pigs are raised in large numbers, and that is where the Taenia solium infestation is also high. And whenever we have a case of focal seizure, we always think of tuberculoma, and our next best differential diagnosis should be neurocysticercosis, because 30% of seizures in these regions, okay, in these the above mentioned regions, it is due to neurocysticercosis. So what is ingested is basically the cysts. So this cyst will go and sit inside will hatch to become the larva. Larva will go and stay in the muscle or in the CNS, eyes, etc. So this will go and sit inside the various parts, and then it will start suppressing the host immune response. When the immune response is high, because of the immune response and because of the inflammation only, the symptoms will start. Most cysts will not immediately release the larva. It will remain asymptomatic for years together. Some cysts can just go degenerate and become calcified. Okay, so that is one cycle. Some cysts will start releasing the larvae, and that life cycle will take place. So the natural history of cyst will be some will resolve completely, some will become calcified, some will release larvae. Most common sites will be it can stay in the muscles, it can stay in the subcutaneous nodules, it can stay in the eyes, it can involve the brain or the spinal, that is it can involve the CNS. So most common when we talk about cysticercosis, it is mostly the neurocysticercosis. So most commonly it involves the central nervous system. So there are cysts in the brain parenchyma that will cause the seizures, or when it involves the subarachnoid space or in the ventricular involvement is there can be headache also. So the most common symptoms of neurocysticercosis will be headache and seizures. So seizures most oftenly it is a focal seizure. When it involves the ventricles, when it involves there is a diffuse cerebral involvement is there, those are all very severe forms. I will tell you what are the CNS involvement shortly. But in an endemic country like India where the TB is endemic, neurocysticercosis when you have to think is when there is a short history of the presentation and there is no history of contact with the pulmonary tuberculosis, there is completely no fever, think of neurocysticercosis first and then second will be your tuberculoma. Okay. So these are all the classification of NCC, neurocysticercosis. Okay. Because this neurocysticercosis mostly it is present in the brain parenchyma. So this is the most common. Okay. So the first and most common will be parenchyma. But not just parenchyma, it can go into intraventricular, it can affect the subarachnoid stage. Subarachnoid is the rare and most severe presentation of neurocysticercosis. It can even involve spinal, that is radiculopathy and myelopathy. So when it involves the brain parenchyma, it presents as seizures and headache. When it involves the ventricles, so any ventricle, lateral ventricle or third ventricle, what happens? It will start obstructing the flow of CSF that results in an obstructive hydrocephalus. So the patient will present to us with signs of raised ICP. Usually there will be no localizing signs, but insidious increase of raised ICP will be there. If it involves the subarachnoid space, presentation will be similar to a basilar meningitis. There will be neck rigidity, fulminant headache, etc. So basilar meningitis kind of a picture will be there. Spinal, of course, features of radiculopathy or myelopathy will be seen. Ocular cysticercosis also is quite common. Ocular cysticercosis will present with decreased visual acuity and there can be a sudden retinal detachment or even the iridocyclitis. Isolated iridocyclitis is also seen.